Okay, everyone, let's start the session. Okay, so today our topic is on article writing. Okay, so that's like the last lecture that we are going to do now. Let me open up the slides. Okay, sorry. Yes, here we are. Okay, so manuscript writing is just like how you guys have been doing for all the other study designs, okay? Like for CDC wonder analysis, for cross-sectional studies, for case controls, and for even for any other study that you have done before, if you have any if you have done research before, of course. It's just like that. Okay, there would be some changes you might say, and we would be discussing them. So, what makes a good manuscript? First thing is a clear and proper scientific message. It should have a logical flow, is written in a clear and understandable language. It should not be all AI, is relatable to the reader. Okay. For a systematic review, even if your article is having a lot of heterogeneity, even if your results are not what you are thinking of, like there was one of our article and there was one of our SRMA that was on ibuprofen for septic shock. Okay, so yeah, so they were, it was about that it does not contribute much for the septic shock. So that is again a major finding that will help in the guidelines. Okay. So it all comes down to how you are phrasing and how you are writing your systematic review and meta-analysis. If you are able to make up good conclusions, if you are able to establish a good flow, and if you are able to make it relatable and all that stuff with good stats, that's all good. So mostly how we report, we write the article start with the title, abstract, introduction, methodology, results, discussion, and conclusion. But um, how we mostly do it, how they are written. First, you have to write the methodology, then you have to write the results, then discussion, conclusion, introduction, abstract, and title. Okay, like this is the pattern you have to move on to. You guys are done with your results. The next step that you have to do is to start writing your discussion, then methodology, then conclusion, then introduction, and then abstract, and then title. Why is methodology we are not doing first? Because we have just like made all the notes on our Word document. We have made the search strategies. We have seen which databases are we going for and all that stuff. Okay. So in methodology, you will just change the details according to your methodology. You will just mostly what people do is whichever journal they are going for or whichever journal they are targeting. Like if I am doing a systematic review on any topic like terzipatide or anything like that, what I will do is I will open up an article, I will open up a systematic review and meta-analysis that is published in that journal, and I will see how have they written their methodology. Okay, then I will copy their methodology and then paste it in my Word document and then remove the words and change the things that are different for my systematic review. And then at the end, I will rephrase it to avoid plagiarism. Okay. And if you have performed anything specifically like your subgroup analysis or sensitivity analysis, any specific keywords, any terms like that, you have to explain that. Explain the outcomes in your analysis, explain any proper and anything that you performed in your analysis. Like if you performed any sensitivity analysis, yes, we have discussed that. Which databases did you go for and all that thing. Methodology means a recipe for your research. It tells the reader exactly what you did with enough detail that anyone would be able to replicate it. Okay. So first you will write about your search strategy, then which studies you selected on basis of what, which studies were excluded, which variables you included in your data extraction sheet, what was the case for the risk of bias, and how did you carry out the analysis. Okay. So you have to touch on all these aspects. Once again, databases used, additional details, start and end date of research, what was the exact strand, what were the keyword, mesh keywords, and what about the terms and all that thing. Okay. And if you went for any manually checking the relevant journals, tell about that, tell about checking the reference list, checking for articles that have cited the included articles. Okay, so what is the backward citation? That means you open up all the those articles that you have included in your secondary screening and you open up the references. Okay, and then you see, okay, the same way I told you guys, you see if any article is related for your sarma. What does forward citation means? You open up the articles that you have included in your screening and you see which articles have cited it. Okay. Like for example, I am doing a SRMA on anything like terzipatide and heart failure. Okay. So I open up a secondary screening article that I have included. And that secondary screening article was also cited by another RCT. So from that thing, that this thing you can get from ResearchGate, okay? Like which articles, mostly we don't go for forward citation, we mostly go for hand searching and backward citation. Okay, for example, this is like one paragraph. An electronic search was performed on PubMed, Embase, Cochrane, clinicaltrials.gov. You will include PubMed, Embase, and clinicaltrials.gov from whatever to your timeline. Mesh terms that were included were used. You have told about that. The detailed search strategies you have to report it. The conference proceedings were answered. We can even write we excluded that. Bibliographies were also searched, like the references were searched. We also perform forward citations using Web of Science. That is also like a PubMed database. We can also say you can say this, or you can even skip it out. What references which software did you use? How many duplicates were removed? What was your inclusion and exclusion criteria? Any filter that you applied? And how was screening done? You have to write about the two authors who assessed it. Any disagreement, anything like specifically you included, you have to report in your methodology. For example, all of the articles were imported into EndNote and duplicates were removed. Okay, two authors, you will write their name, just the initials, independently screen the titles and the abstracts, and remove those not fulfilling the inclusion criteria. Full text were reviewed against the eligibility criteria, conflicts were resolved, we included RCTs, and all those things you have told about the inclusion criteria. Study designs, other than RCTs, animal studies and studies not reporting were excluded. We did not apply any language restriction. Okay, they have told about how to write it. Then you also have to tell in your methodology what data extraction variables did you go for, primary and secondary outcomes, and all that stuff. Then what tools that you use for your risk of bias assessment? Who were the authors who used who undertook the ROB assessment? Okay, once again, data extraction. This is all the stuff that you have done. Okay, and you all know it. This is just now you have to write it. Data extraction was undertaken independently by two researchers. In case of disagreement, it was resolved. These were the variables. The primary outcomes were this, the secondary outcomes were this, and all that stuff. Okay. Then what happened? Two independent authors assess the risk of bias, and they use the ROB2 tool. These are all the biases that are in that ROB2 assessment, and that's it. Then the next step would be the data analysis. Then in data analysis, we will also do a hands-on. I will open up an article and I will show you guys how it is mostly written. Okay. But this is the stuff that you know mostly. Writing the manuscript is like the last effort. Okay. Now you have done the major part. If this is just the last thing that you have to go for. Okay, so mention which effect model are you going for, which software did you use, mention if you use any subgroup and sensitivity analysis, comment on those forest plots, what was about the risk ratio and the odds ratio, funnel plots, I-squared, talk about them, and was there any heterogeneity or anything like that. Okay, risk ratio and mean differences were calculated, in which random effect model was used, and all that stuff. The pool results were represented graphically as forest plot. They are all the same things. Okay. Then subgroup analysis was performed. The subgroups include, if you perform the subgroup analysis, then you have to mention it. The mismatch between the number of studies in the manuscript result section and the Prisma flow diagram this is very important, as you have to make sure that there should be no inadequate reporting. Okay, if you say in your manuscript there were 42 duplicates, you have to mention 42 duplicates. These many articles were excluded in primary screening, you have to exclude them in the primary screening. These many articles were included in the secondary screening, you have to include them in the secondary screening, and all that stuff. It is crucial to meticulously cross check and reconcile the number, because a systematic review is all about being systematic. Okay, you don't have to make any mistake in the methodology and all that part. Arrange your forest plots in order of the importance, primary outcome before the secondary outcomes, and even in that case, the significant results before the not significant results. Okay. And how you will describe each forest plot: first, number of studies reporting that outcome, then what's the result, and if you have performed any subgroup analysis. Last thing, that's the discussion. In the discussion, what you will do is a brief comment on implicate. Okay, first you will compare. If you are updating it, compare with the previous SRMA. Even if you're not updating it, even if you're like doing on tirzepatide for heart failure and there is no SRMA available on tirzepatide and heart failure, you can talk about other tirzepatides systematic reviews, okay, for other things. Then compare with the main clinical trials. All those things that you have included in your secondary screening, talk about them. You have to now talk about all the things that those RCTs were they were talking about. Okay, now you have to compare them. You have to tell about them. Like this article was this author, anything that was included, any article that was included in secondary screening. What did their authors tell you about the final outcome or about that drug? You have to talk about that. Now you have to support your findings. You have talked all about in your analysis that this drug is good, this has more safety, this has more this, and this has more that. Now you have to prove it. Touch each and every secondary screening article separately and any SRMA previously. Discuss your finding, pick the most important finding. Identify the causes of similarities and differences if there are in between the articles. Comment on the pathological mechanism if relevant. And then this is the last paragraph. Comment on implications on policy and practice, but don't sound too preachy, just a little bit like this will help us in policy making or this will help us further upgrade about the treatment for cancer or anything like that. Okay. Repeat for each finding in a new paragraph. This you have to compare. You have to write this like one para for each finding. Okay. For each finding, talk about that article, compare it, any differences among the studies, and what any implication on the policy and practice. Okay. Discussion writing is like the most important part of a systematic review and meta analysis. Explain the result, their significance, any subgroup analysis. In the first paragraph, introduce both the techniques. Like if you are comparing one technique with another, introduce both of them. Explain about your meta that we conducted this, and then outcomes and brief conclusion. And then in second para, explain about the previous metas if you are updating it. Take each finding one by one and support through previous metas and reason for this effect. Okay. So this is like a pattern. In first intro, you just now introduce both the techniques again, just one line. Like these two techniques are used, and this meta was conducted to compare them. These were the outcomes, and our outcomes proved that this approach is better. Then, if you are updating it, talk about the previous meta, and if not, take one result and discuss all these parts of it. Okay. Then at the end, strength and limitation, future implications, conclusion. Limitations, be honest in mentioning the limitations. Any limitation that you can write, but don't go for explaining everything. Mostly what people do is they write about the risk of bias assessment here, or what about they write that the cross section studies were excluded and other articles were excluded, or there were not much RCTs on it, or more studies are needed, or if there is any like heterogeneity and stuff like that, they can comment on that. Conclusion, mention your primary finding again, mention implications on policy, clinical practice, and future research. Now, if first we discussed about the methodology, then results, then discussion, then introduction. At the end, we will be seeing an article and we will go through this stuff again. Okay. An introduction is like basically the an easy part. As a recipe for your research, tell the reader exactly what you did with enough detail. No, sorry, that was for the methodology. It's like a copy stuff. Let me delete that. Introduction has basically these components. First, you will talk about the background of those two approaches you are comparing, or if you're not, talk about that drug. What is known about that? What is unknown? Because in a systematic review, we are mostly talking about the unknown because we are going to be conducting a new thing. What's your rationale and what's your study question? What is known? Discuss the established and most commonly employed treatment that this treatment has been used for many years and all that thing. Talk about the efficacy and safety results, advantages before moving on to the shortcomings. And then you can say that now this drug has been introduced. There are now studies that promoting it. but there's no proper systematic review done on it to give us systematic evidence approach. So we are conducting this systematic review to provide evidence for the usage of this drug or approach for this condition. 4 to 5 paras. First, describe about the population, then the intervention, then control, and then the rationale. If updating, this is very important. If you are updating your systematic review, you have to bring up a very, very good reason why you are updating it. In the supplementary file, a Word document containing all the extra tables and figures, but not important enough to be included in the manuscript, you can include the Prisma checklist, complete search, the search strategy. In the result section, you will not include the subgroup analysis that is included in the supplementary file. Okay. For even the heterogeneity that you will remove, that will be in the supplementary file. The funnel plot, the traffic light plot, all in supplementary file. Abstract the supercharged trailer of your research, provide a brief overview, make it as good as you can. 150 to 250 words. It can be structured or unstructured. Mostly we go for a structure. And the second most important section in the paper, what's the first one? That's the discussion. Then the title, most important, it's also the title is the important one. Follow the PICOS framework, should be concise, clear, and informative. Don't oversell your result, don't exaggerate, don't use words like groundbreaking. You are scientific people, you have to write in a scientific way. No previous study has assessed this outcome versus to our knowledge, no previous study has this is better. Spelling and grammatical mistakes are not tolerable. Don't use informal language. Okay, mostly what people do is they write a rough manuscript and then they send it for publication. Okay, thinking that after the first revision I would revise it. But now the journals are having too much load of articles. Okay, so when you submit a half done essay or a sorry manuscript to a journal, mostly the journals are now rejecting it. Okay, that's why the chances of rejection are increasing because the editors don't have time now. They are receiving so many articles, so many sermons, so many things at the same time that they don't want to spend enough time on an article just editing it, just checking for the spelling and grammatical mistakes or formatting it. So now you have to make sure that you are properly using proper spellings, proper grammar, proper formatting, and all things should be done beforehand to decrease the work of the editor. Okay. Make an outline first. This is just like some of the steps. Expand each one into find relevant references right away. Don't switch gears abruptly. It should be all linked. Okay. Let's do a hands-on. Let me show you a manuscript, systematic review, and a meta-analysis. This one was good, I guess. I opened up one. Okay, let me show you. Okay, yeah, this one is good. I guess this is full article. Yes, this is full article. Okay, let's see. So first, what they have done is they have written the title, The Efficacy and Safety of Tirzepatide in Patients with Diabetes, Systematic Review and Meta-Analysis of Randomized Controlled Trials. Here you can write randomized controlled trial or you can even go for not writing it if you are including cohort studies also. Okay, and most of you guys we will do go for doing the grade assessment, so you have to do systematic review and meta-analysis with grade assessment, then the author's name, then all that stuff. This is the title page stuff. Now we're moving on to the abstract. This abstract is known as a structured abstract. Okay, why? Because they have divided it into background, methodology, results, conclusion, discussion here, and registration number also of Prospero. Okay, at the end you will guys will register on Prospero, and then what you will do is you will register on Prospero and then write the registration number here. Obesity and type 2 diabetes are major public health concern. Tirzepatide has shown promise. This systematic review helps to evaluate. What simple statements, okay? Then methodology, PubMed, Embase were used. Just copy this stuff, okay? You don't need to like start writing in your own ways. This is like if an article is published in a good journal, you can just copy the way they have written it, okay? Then the results, 14 RCTs, these many patients were included, and just a one liner, it helped in this thing compared with this. When compared with this, it was good. Increase risk of nausea and all that stuff. Then conclusion, and then the registration, then the keywords. In the introduction, once again, they have discussed about type 2 diabetes, then the first approach, then the second approach, then the rationale. Simple. What about the methodology? Okay, so this was about the methodology. They have written the name as results over it, but it's the methodology. A total of 603 publications were included. These many were excluded. This stuff. They were comparing this stuff. The data extraction sheet, they have talked about that thing. Then the Prisma flow chart, baselines. This is the outcome sheet. Then the results, meta-analysis. Okay, and then the results. They have reported it. Okay, you can see that each result is reported as each outcome is reported as a separate para. Okay, all doses compared to placebo, and okay, what they have done is achieved higher reduction. Tirzepatide was associated with large portion of patient achieving a reduction. This is the odds ratio. This was the heterogeneity. This was the confidence interval, and all that stuff. Yes. Changes in HbA1c, type 2. Okay, they have talked about all the outcomes. Even you can take help from you can take help from AI, you can take help from Perplexity to help you further better explain how that forest plot, okay? And it would be without plagiarism. Then the discussion, then they have included methodology at the end, the search strategy, eligibility criteria, outcome, statistical analysis, conclusion, supplementary materials, and all that stuff. Okay, so all easy. One thing I guess that's left, that is this one. Okay, let's go through this. Okay. This is a little bit of a stats stuff. What is risk? Risk is like the number of events of interest divided by total number of observation. Total number of events that have happened divided by total of the events and number of events of interest. For example, how many people died? Okay, so mortality divided by total people who were being observed. What is the probability that today is Monday? One day of the week is Monday divided by 7 days. What are the odds? That's a little different thing. Probability of occurrence divided by probability of not occurring. What is the probability of Monday? 1 over 6. Okay, so it's a little different. Here we are dividing by the total. Here we are dividing by the non-events. That's just like for just for knowing stuff. Important thing is that you should know, make sure you are clear, like whether on what hand side are you putting the intervention, in the numerator or in the denominator. Okay, for the dichotomous variables, we are using the risk ratio, right? Are we are going for using the risk ratio because odds ratio is used for the case control studies. So you will talk in the terms of this intervention has more odds of causing this thing. But for continuous data, you will talk about mean difference. Mean difference is mean outcome in intervention minus mean outcome in control. There is no division. Hemoglobin levels are on average. This mean higher in this group as compared to that group. Okay. If it is in negative, that means the control is being preferred. Okay. A risk ratio means risk in treatment group over risk in control group. Risk difference. Okay, let me see an example. Mm, okay. Compare the probability of an event happening in a trial. 10% of the patient died with drug A, 20% died with the placebo. That means risk in group A is zero point 0.1 and group B is zero point 0.2, that is 0.5. If it is less than 1, that means the treatment reduces the risk. For example, less people are dying with the drug A, that means the treatment is reducing the risk. When we put treatment in the numerator side, okay, we have put drug A, that is a good drug. That is the approach we are going for in the numerator, and the other one in the denominator, and the value has come out to be less than 1. So that we are saying the new drug is reducing the risk, less people are dying from it. If it has come out to be 1, that means there is no difference between the two drugs. If it is more than 1, that means it is increasing the risk. But for continuous, we will go for mean difference. Average BP with drug A is 120, every BP with placebo is 130. If what is the mean difference? That means the drug A is causing a drop in the BP by 10 millimeter of mercury. If it was no difference, it would have been no difference if the mean difference was 0. Okay, so that was it. And let me just go through it another one again, and then we will just conclude the study. Okay, so this one is a pharmacological treatment for obesity in adults and a systematic review and meta-analysis. Okay, once again, the abstract, that's important. Here they have written an unstructured abstract. Okay, this means that there is no division. The first two lines are about the background, then they have talked about the methodology, then they have talked about the results, and then end, and there is no headings in it. Okay, let me open up the PDF. Let us go down. It's kind of like an network meta-analysis. Let's not open up the network meta-analysis. That's a different thing. Okay. I guess we have the full article of it. No, we don't have it. Let me open up another full PDF. Mm, okay, no, that is also an RCT for weight loss. Okay, let me open up this one. I guess this is a full. Okay, yeah, this is a full article. Okay, let's see now. So this is the first one is the first one is the abstract. They have talked about the background. Then we have the methodology. Okay. Went for this one, this thing, and then the results. Then the conclusion. Again, introduction. Then the methodology. Then the search strategy. You just have to like change the stuff that is your difference. Risk of bias, statistical analysis, study flow and selection of studies, study characteristics, prisma diagram. Okay, so this is the study characteristics of the included study, the first Excel sheet that you guys made. Risk of bias assessment. This is the traffic plot, the plot that you guys made from your from on during the risk of bias assessment. This again from the Robin tool. Then meta-analysis of body weight change. Now it will discuss each and every point separately. This is the forest plots, all the forest plots together. Incidence of adverse effects, also the subgroup analysis they are doing, they are including it. Okay, most difficult thing that you guys might face is writing the result section. Okay, and you have to take help from different softwares for writing it. Okay, from you can even use perplexity, but you have to make sure that you are looking at the results right. Let us go through the results now. Our meta-analysis evaluated the effects of trazipatide on body chain, the eye statistics, all that thing. Okay, this is all basic stuff. Let us go down. For subgroup analysis, they are saying that we divided them. Okay, indicating enhanced efficacy, showed no greatest with substantial and highly significant. What do they mean by significant? They have written the mean difference, then the p-value, the confidence interval. Okay. Then once again, the subgroup analysis, they have mentioned that. Okay. Then meta-analysis for the weight loss. So weight loss more than 100. This was the heterogeneity was this one, this much. And For subgroup analysis, we did this. That is all basic stuff. Okay, this is a little bit done in a detailed way because they have done subgroup analysis very detailed. Okay, so that's why it's written like this. Otherwise, it's not that difficult. They have gone into the results in too much detail. Discussion is an important thing, but it is easy to write. So I guess this has covered the most of the stuff. You guys will be able to do it perfectly. The introduction is not that difficult. Even the methodology, even the discussion. Results would take a little bit of your time. You have to make sure that you are putting the intervention in the numerator, or even if you are saying like if it is, you have to see properly. Okay, you have to see the stuff properly, you have to add the values properly, you have to see the mean difference, is it proper? Okay, first make your own conclusions, like this is the mean difference that is coming, that means the intervention group is helping with this outcome, and then take help from Perplexity or different software to see are you reporting the right outcome or not. Okay, and that was it about the manuscript writing.